Narrator, VO. Hello, and welcome to UMCC Medical Consultant Connectors, where your health matters to us. Narrator, VO. I'm Dr. Sanjay Gupta. Narrator, VO. On behalf of everyone at UMCC Medical Consultant Connectors, thank you for joining us. Narrator, VO. Your health is our #1 priority. Narrator, VO. Clear, accessible information is a powerful tool. Narrator, VO. Today we're talking about anticonvulsants. It's a long word but straightforward. Narrator, VO. Our goal: break down the science, answer your questions, and empower you to talk with your healthcare provider. Narrator, VO. So what are anticonvulsants? Narrator, VO. Medicines originally developed to treat seizures, sudden uncontrolled electrical disturbances in the brain. Narrator, VO. They can change behavior, movements, and feelings. Narrator, VO. Anticonvulsants calm excessive electrical activity. Narrator, VO. Also called anti-seizure or anti-epileptic drugs. Think of them as stabilizers for the brain's electrical network. Narrator, VO. The most common reason, epilepsy. Narrator, VO. They also treat certain nerve pains, like diabetic neuropathy. Narrator, VO. Trigeminal neuralgia is another example. Narrator, VO. They can act as mood stabilizers in bipolar disorder. Narrator, VO. They also help prevent migraines and relieve conditions like fibromyalgia or post-herpetic neuralgia. To understand how these medicines work, let's talk about how they move through your body. Pharmacokinetics. First, absorption. The pill dissolves and is absorbed into the bloodstream. Then distribution. The drug travels through circulation to organs, including the brain. The drug reaches the brain where it starts to work. The liver metabolizes many anticonvulsants that affects how long they act. Kidneys often excrete metabolites in the urine. These steps, absorption, distribution, metabolism, excretion, determine drug levels over time. Now pharmacodynamics. What the drug does to the brain. Neurons communicate with electrical signals and chemical messengers called neurotransmitters. Seizures occur when signals are too rapid and disorganized. One mechanism, blocking sodium channels, reducing rapid firing. Another, blocking calcium channels, also slowing excitability. These effects raise the seizure threshold and calm brain activity. Some anticonvulsants boost the inhibitory neurotransmitter GABA, turning up the brain's off switch. GABA stands for gamma-aminobutyric acid. Other drugs reduce excitatory signals, blocking glutamate receptors to prevent runaway activity. The net result, prevention of the chain reaction that causes a seizure. The drug's mechanism helps determine which conditions it treats. That's why your doctor chooses a specific anticonvulsant for your needs. Understanding mechanism helps you ask informed questions about your treatment. It is critically important to understand that anticonvulsants can interact with other medicines. These interactions can change how either drug works, making one less effective or increasing side effects. Some anticonvulsants speed up liver metabolism of other drugs. For example, birth control pills may become less effective. Blood thinners like warfarin can be affected too. Combining anticonvulsants needs careful management. Always tell your doctor and pharmacist about every medicine you take. That includes over-the-counter drugs, vitamins, and herbal supplements. Some drugs can increase anticonvulsant blood levels to toxic ranges. That's why blood level monitoring is sometimes necessary. Examples include some antibiotics and certain antifungals that can raise levels. Even common medicines like aspirin may interact in specific situations. Certain antacids can alter absorption of some anticonvulsants. Always check with your healthcare provider before starting any new medicine. Open communication prevents dangerous drug interactions. Some people should not use certain anticonvulsants, or must use them with caution. A known allergy to a specific anticonvulsant is the most important contraindication. Serious allergic reactions require immediate care. Narrator, VO. The use of anticonvulsants during pregnancy requires very careful consideration and planning. Narrator, VO. Ideally, this conversation happens before you become pregnant. Narrator, VO. Some anticonvulsants increase the risk of birth defects, especially in the first trimester. Narrator, VO. But uncontrolled seizures during pregnancy also present serious risks to mother and baby. Narrator, VO. A team approach with your neurologist and obstetrician is often used to find the safest plan. Narrator, VO. The goal is the lowest effective dose of the safest medication for you. Narrator, VO. Doctors may recommend higher dose folic acid before and during pregnancy to reduce certain risks. Narrator, VO. It's a case-by-case, careful balance weighing risks and benefits. Narrator, VO. Never stop anticonvulsants without talking to your doctor. Sudden withdrawal can trigger seizures. Narrator, VO. Like all medicines, anticonvulsants can cause side effects. Narrator, VO. Common side effects often occur when starting and may lessen over time. Narrator, VO. Drowsiness. Narrator, VO. Dizziness. Narrator, VO. Fatigue and feeling unsteady on your feet. Narrator, VO. Some people experience nausea or blurred vision. Narrator, VO. Headaches may occur. Narrator, VO. Take precautions. Avoid driving or heavy machinery until you know how the medication affects you. Narrator, VO. Most initial side effects are manageable. Report them to your doctor. Narrator, VO. Some side effects require immediate care. Narrator, VO. If you develop a new rash, blisters, mouth sores, or fever, seek emergency help right away. Use caution when taking anticonvulsants. These are powerful medications that require careful management. Take your medicine exactly as prescribed, do not skip doses, and do not stop suddenly. That can trigger seizures. Avoid alcohol when possible. It can increase drowsiness and lower your seizure threshold. Track symptoms and be mindful when your dose changes. Give your body time to adjust. Be patient with the process. Wear a medical alert bracelet or carry a card listing your condition and medications. In an emergency, this can be life-saving for first responders. Keep scheduled appointments. Follow-ups are essential for monitoring. Report side effects and participate actively in your care. Tests may be used to confirm safe drug levels. Your active participation is the most important factor for the best outcome. You are not alone. Support groups and clinicians can help. Use reputable sources to stay informed. Understand what your medications are and how they work. For direct personal questions, contact your qualified healthcare provider. Thank you for joining us today. Here at UMCC Medical Consultant Connectors, we're committed to reliable health information. A well-informed patient makes better health decisions. Your health matters to us. We're honored to be a resource. Thank you. And remember, UMCC Medical Consultant Connectors, where your health matters to us.